As summer takes shape, most people are eager to step outside and take advantage of the warm weather. However, soaring temperatures and harsh sunlight can pose health hazards, and even leisurely activities come with hidden dangers. So, joining us today to discuss summer safety is Dr. Gary Lai, Chief of Emergency Medicine at Broward Health in Coral Springs. His journey to medicine is a personal one. As a child, he suffered from asthma, which landed him in the ER a few times. So, Dr. Lai, thank you so much for being with us, and let's jump right into it. So, heat-related illnesses such as heat exhaustion and heat stroke are the most common ER visits during the summer, correct? What precautions should be taken on these sweltering days to reduce the risk of health-related illnesses, basically heat-related illnesses?
Absolutely. Just like you described, we're fortunate to live in South Florida where, it's beautiful weather year round, but the heat and the sun is very strong, and it's very important to try to avoid, the peak, sunlight hours, and try to enjoy your activities maybe more in the early sun or in the later afternoon, not being out there at peak hours, and making sure you stay hydrated, so most commonly patients will start developing like headaches and nausea and profuse sweating and muscle cramps, and those are the symptoms that you can have that are, your warning signs for heat exhaustion. So you definitely need to kind of, at that point, stop your activity, look for some shade, maybe loosen off the sweaty clothes and keep hydrating yourself and cool yourself down.
Yeah, it's interesting that you mentioned that because, some people don't realize they're dehydrated. They're not drinking fluids. They're outside perhaps, not even doing exercise, just either driving or walking or standing, basically waiting for someone. And then they might experience cramping, which they hadn't before, and they wonder why is my leg cramping or my arm? So you're saying that that's basically or could be related to dehydration.
Absolutely. Because, we have to kind of think about not just the ambient temperature, but also the humidity. And like in South Florida, when the humidity levels get above 75% or so, it decreases the body's chance of having that sweating mechanism to cool the body off. And at that point, that's when you start overheating. And then if you don't, stay hydrated or replenish the salts that you lose, that's when you start developing the muscle cramping.
So do you suggest that we carry around like a water bottle, even if we're not going to be exercising, just if we're going to be saying running errands, getting out of the car, getting inside the car can heat up a lot, right? So as we, do shopping in supermarkets or at stores and we get back into the car, the heat, do you recommend that we just carry something around with us at all times, like a water bottle that keeps the water or any other kind of juice cold?
Absolutely. I think you bring up a good point with that. If people are eating like small meals throughout the day, small snacks, and hydrating well enough, that's one thing. But, the typical person, may go longer than that. And, you don't stay hydrated on top of that. And the fact that you mentioned that point about like the heat and the temperatures in the cars, I wanted to kind of just touch on that because, a lot of times people may underestimate. They might think, hey, the outside temperature is only about 80 degrees. So it's not a scorching 100-degree temperature day. But, any animals or any little ones left inside the car on an 80-degree day, it can easily reach temperatures above, 112 Fahrenheit very quickly. So that's something to kind of keep in mind. But yes, definitely staying hydrated is key.
Yeah, I have been experiencing migraines a lot lately, and I'm not really sure why. I've always had them, but basically sporadically, once in a blue moon. But lately I've been experiencing them a lot more, and I feel like I'm outdoors a lot more than I used to be. Are migraines connected to like dehydration or heat related, condition or reaction of the body to heat?
It could definitely exacerbate migrainous conditions when you have that. Also, we always tell people to kind of limit the caffeine intake, because if you're outside and you're sweating a lot and you're drinking caffeine or you're drinking some other energy drinks, they can affect your heart rate. And if you have a persistent fast heart rate coupled with, a body that's already overheating and losing its kind of heat loss mechanism and cooling mechanism, it can definitely exacerbate multiple medical conditions, including migraine headaches.
And so let me ask you something. Sometimes we feel, drained, like we don't have that much energy. Is that somehow connected with the heat that, makes us perspire and lose potassium, or where that then in turn makes us feel like we're lacking energy? Or is that something else?
I think just overall, trying to live a healthy lifestyle and have a balanced diet and healthy diet and, staying hydrated will give your body the best source of, as far as terms of energy and immune system and, having that vigor to do your activities. But, if you don't treat your body right, if you don't put the proper nutrients into it, couple that with the, intense heat outside, you're kind of just setting yourself up for, illness.
And besides water, to stay hydrated, what else would you recommend we drink when we're outdoors?
If you're outside in this heat and sweating for hours, then you definitely will need to replenish your electrolytes with some, balanced electrolyte solutions out there. But typically, if it's not like such a strenuous day, if you're not doing it for a prolonged activity, they don't usually recommend salt tablets. Usually just like, balanced meal and plenty of water will keep your salt stores where it should be. Unless you're out there for hours and just burning it off, then you should use some electrolyte replenishment.
And what about folks that go to the beach here in Florida, for instance? Now everybody's at the beach and a lot of people take like alcoholic drinks, whether it's wine or Prosecco or, a mixed drink, a cocktail, even if it's cold. How does the body react to that? And does some people may not realize that they're becoming dehydrated because, they're in the water, they're swimming, and then they come out, they drink. What are some of the telltale signs to look for to, make sure that you understand that, you are becoming dehydrated, even though you may not feel it?
Yes. I mean, alcohol in combination with, prolonged heat exposure, it's going to act like a little diuretic. You're going to be, losing more liquids after drinking that. And then, yes, telltale signs would be developing like the headache and nausea, sometimes even vomiting, muscle cramps. Those are the main things with, excessive sweating.
So let's talk about the food. We were talking about the beach, and besides something to drink, we normally take food to the beach. And, in this heat, food can go bad, can spoil. So what are the best practices for food safety when going, say, on a picnic or to the beach?
You have to definitely stay on top of keeping the perishable foods cold. You got to keep them stored nice and fresh. When you're handling, like produce and meats, you want to kind of make sure you're washing your hands in between and not cross-contaminating things. And especially with meats, you want to make sure you're cooking thoroughly enough because, in this hot weather, bacteria multiplies and grows even faster. So that's why we got to take extra precautions with that. But keeping the side condiments like the coleslaws and the potato salads, like keeping them nice and cool, putting things away when you're not using it, and just, disposing of food that's been out there for a while so that people aren't, exposed to that.
So other than wearing sunscreen, what are some other ways to protect the skin from too much sun?
You definitely want to avoid the peak hours of the sun, also kind of look for areas of shade. And then you can always wear like loose fitting clothing. There's lots of clothing out there that offers, SPF and UV protection. So those are the best ways to kind of go about.
What is really the optimal protection in sunscreens?
I think everybody's a little bit different. I've seen where it says, at least SPF 45 or even higher. But I think the most important part of it is, applying it and, making sure you reapply in case you're getting into the water or you're just excessively sweating it away, making sure, because if you put on like a SPF like 60 or something or 70, and the highest thing you can find, and all of a sudden you jump in the pool or you jump in the ocean and most of it's kind of washed off right away. If you don't reapply, you're still not going to have the effects as something lower that you reapply on a regular basis.
And if you have recently had an operation on your skin, should you avoid the sun altogether? And if so, how long before you should expose that part of your skin or your body to the sun?
Absolutely. You don't want kind of, freshly operated skin and exposed to the elements, but that's something I would have to take up with the, specialist, the surgeon itself, but you bring up another topic as well. Like, as far as like medicine goes and surgery, like the public doesn't know there's so many medications out there that can cause what are deemed photosensitivity reactions, in which you take your regular medication, but you head out in the sun and it can accelerate like a sunburn process when you typically wouldn't have a reaction to, say, you were out there only like 30 minutes. But the fact that you were taking some of these medications, and some of these medicines are pretty common, some antihistamines, like Benadryl, or some antibiotics like sulfa medications or tetracycline. There's some diuretic medications like thiazides, hydrochlorothiazide. Those are common medications that people take that out in the sun can, put you at risk for photosensitive burns.
Is that the same with, say, some antibiotics that people might be taking?
Yes. Like common ones like the trimethylphensulfomethoxazole, which is also known as Bactrim, or the tetracyclines like doxycycline. Those are common ones that can cause that photosensitivity.
This is interesting that we're talking about this, because I know also just being exposed to the sun for long periods of time or to the heat, for instance, can trigger some asthma attacks. Is that correct? And what can we do to avoid it?
Yes, especially in the warmer months, we'll have like increased pollen and grass in the air, and that's definitely not good for asthmatics. And definitely keeping your rescue inhaler on hand, so when you need it, make sure it's available. But also, if you're taking like maintenance medications for allergies, definitely make sure you stay on top of that and take that daily to prevent, any asthma exacerbations.
4th of July is right around the corner. And according to the Consumer Product Safety Commission in 2021, there were 10,000 emergency room visits just from fireworks alone. But, burns can also be caused by the grill, when you're grilling, in backyard fire pits, etc. So what do you recommend in terms of giving advice on how these activities can be enjoyed in a safely manner?
I think just, having common sense and, practicing, basic kind of fire safety rules, and when it comes to grilling, wearing protective gloves when you're handling the fork or the skewers or the tongs. Make sure you have something heat protective on your hands. Try not to when you're lighting fireworks, don't do anything out of the ordinary. Make sure you don't light a bottle rocket in your hand and try to set it off, or these like M80s and stuff. That's where we see these big traumatic injuries, when you start doing things that you're not supposed to do, and take it out of the safety context of the individual item.
So any final tips for staying healthy and happy this summer and avoiding emergency room visits?
Yes, try to stay out of the emergency room from this. be kind of smart about it. Pick the off-peak sunlight hours to go out there and have some fun, and just take precaution, eat a healthy diet and stay hydrated. And I think, along with the SPF sunscreen protection, loose fitting, cool clothes, and just kind of, keep it in mind, symptoms to look out for. We discussed that, the headache, the nausea, the excessive sweating, the body cramps. But, when you start going from heat exhaustion symptoms to heat stroke symptoms, that's when you start getting like confused or seizure activity or just extreme temperatures of like 103 Fahrenheit or above. That's when you really need to head to the ER at that point.